So today we are discussing about the attachment of humerus. Attachment of humerus means that is the muscle which is originating from the humerus and the muscle which is inserting into the humerus. So just go through this picture. In this picture, those that are marked with red color mean it is the origin. Red mean it is the origin. And the blue color mean it is insertion. Okay. Red color mean the muscles are originating from the humerus and blue color mean the muscles are inserting into the humerus. So two pictures are here. First one is the front view. Front view mean if you saw me while this is my humerus. This is the view. Okay, this is the front view. And I turn like this. Okay, my humerus is like this. That is the back view. Two pictures I draw here. Just go through the picture. Let's discuss the attachment, that is the insertion and origin one by one. Okay. So first of all we are discussing the insertion. That is blue color mean insertion. So first of all we are discussing the insertion. Okay. So the first muscle, that is subscapularis. First one is subscapularis. Okay. The subscapularis muscle is inserting into this region. That is a lesser tubercle that is present on the upper end of humerus. So the subscapularis is inserting into the lesser tubercle. Okay. Subscapularis is inserting into the lesser tubercle. So first muscle completed. Then the second muscle, that is supraspinatus. Supraspinatus I marked in this front view and also in the back view. Here it is supraspinatus. Okay, supraspinatus I marked in the front view and in the back view also. So this region, this is lesser tubercle, just opposite to the lesser tubercle. We know that this is the greater tubercle that I told in the last class. So the supraspinatus is inserting. Okay, supraspinatus muscle is inserting into the upper impression of the greater tubercle. This point, that is greater tubercle, the upper impression, the tip. Okay, so the supraspinatus muscle is inserting into the upper impression of the greater tubercle. That is the point I want to convey with you. Second muscle completed. Then the third one is infraspinatus. The infraspinatus muscle is also inserting into the greater tubercle but into the middle impression. Okay, so the upper impression supraspinatus is inserted, into the middle impression the infraspinatus is inserted. Okay, so the what we say, supraspinatus is inserted into the upper impression of greater tubercle, infraspinatus is inserted into the middle impression of the greater tubercle. That is the third muscle we are discussing. And the fourth one is what we say, teres minor muscle. Teres minor muscle is also inserting into the greater tubercle but into the lower impression. So from the greater tubercle we have, from the upper impression of greater tubercle we have the supraspinatus, from the middle impression we have the infraspinatus, and from the lower impression we have the teres minor muscle. Okay, so subscapularis completed, supraspinatus completed, infraspinatus and teres minor completed. Then let's move into the pectoralis major muscle. Okay, so in this region, the last class I told you, here we have the what we say lateral lip, here we have the medial lip, in between we have the intertubercular sulcus that we discussed in the last session. So here you must understand that from the lateral lip, okay, from the lateral lip the pectoralis muscle is inserting into the lateral lip. Okay, the pectoralis muscle is pectoralis major muscle is inserting into the lateral lip, and the teres major, not minor, teres major is inserting into the medial lip. Okay, so the pectoralis major muscle is inserting into the lateral lip and the teres major is inserting into the medial lip. That is the point I want to convey with you. And here you must understand that in between mean here we have the intertubercular sulcus. From the into the intertubercular sulcus, the latissimus dorsi is inserting. So pectoralis major completed, teres major completed, and latissimus dorsi completed. Then another muscle that is inserting into the humerus is this one. That is the deltoid, the important muscle that giving the shape of our shoulder. That is the deltoid muscle. The deltoid muscle is inserting into the, see, I draw it here in a V pattern. There is a V pattern. That is a V-shaped tuberosity of deltoid. Okay. So the deltoid is inserted into the V-shaped tuberosity of deltoid, and another muscle is also inserting here. That is the last muscle we want to discuss. That is insertion. That is coracobrachialis. See, this border we know. Which border is that? I already told. Which border this side? That is medial border. So from the into the medial border. Just here, mean the medial border, the middle of the medial border, the coracobrachialis muscle is inserting. That is the point that I marked. So all muscle which are inserting into the humerus that we discussed. Okay, that completed. Then let's move into the origin, which are the muscle that is originating from the humerus. Okay, so second session. So just go through this picture. Here we have the shaft. Okay, this region is shaft region, lower part of the shaft. From the anterolateral surface and from the anteromedial surface, and slight portion from the what we say posterior surface, that I marked here. Okay, from the anterolateral. Okay, we have the anterior border here. This is anteromedial and this is anterolateral, and slight from the posterior surface. The muscle, which muscle? The brachialis muscle is originating from the shaft. Okay, understand? Then the next muscle, that is brachioradialis. Brachioradialis means this region. Which is this region? That is lateral supracondylar ridge. This one, medial supracondylar ridge. From the lateral supracondylar ridge and upper 2/3, the brachioradialis is originating. Okay, the brachioradialis is originating from the upper 2/3 of the supracondylar ridge, lateral supracondylar ridge. Just below, then lower 1/3, there we have the extensor carpi radialis longus. And from the medial epicondyle, okay, from the medial and from the lateral epicondyle, from the lateral epicondyle, all the extensor muscles are origin. That way we given the point CEO, that is common extensor origin. And here from this region, that is, which is this region, that is what we say medial epicondyle. From the medial epicondyle, the CFO, that is common flexor origin. All the flexor muscle, those muscle which is helping in flexion, that is originating from this. That is the common flexor origin. Here the common extension origin. And from the medial, what we say, medial supracondylar ridge, we have the originating of pronator teres. That I marked here as PT. That is pronator teres. And just go through this side. This side means here we have the aconius. Aconius means it is also originating from the lateral. This is the lateral border, lateral side, posterior surface, lateral view. Okay, back side, posterior, the originating. Aconius is originating from there. And lastly, we want to discuss about important one, that is the triceps brachii. The lateral head of triceps brachii and the medial head of triceps brachii. MHTB means the medial head of triceps brachii. So the lateral head of triceps brachii is originating from the, this is the posterior or back view. From there the oblique ridge, above the radial groove we have the oblique ridge, this line, this is the oblique ridge. From the oblique ridge, the lateral lip of triceps brachii is originating, and below the radial groove, spiral groove, we have what we say the origination of medial head of triceps brachii. So these are the important muscle that is originating from the humerus, and already we told about which are the muscle that is inserting into the humerus. So the attachment session completed. Then we are discussing about the ossifications. Okay. The ossification means the humerus is ossification. There are two centers, mean primary centers are there and secondary centers are there. And for ossification, the humerus have one primary center. The humerus have one primary center and 7 secondary center. Okay, understand that point. And along with today we are discussing another important point. It's very important. Just consider this humerus. Okay, here we have the surgical neck, and here is a radial groove, and here we have the supracondylar ridge. So any fracture, okay, it's an important one. Any fracture which is occurring in this region means there is a surgical neck region, the axillary nerve is got injured. And the second point is that any fracture that is coming in this radial groove section, the radial nerve is injured. And the third one is any fracture which is occurring in the supracondylar ridge or epicondylar region, the ulnar nerve is injured. Okay. So the surgical nerve, axillary nerve is injured. In radial groove, radial nerve is injured. In middle epicondyle, the ulnar nerve is injured. So fracture occurring in this region, these nerves are getting injured. That is the point that I want to convey with you. And the last point is that the clinical anatomy that is related to the humerus. The clinical anatomy we want to discuss very importantly is the supracondylar fracture. It will ask in a 3-mark question. Okay. The supracondylar fracture means that I drew it here. Okay. Just go through this picture. Here we know that the lower portion of the humerus is deviated medially and upper portion deviated laterally. So what this fracture that is occurring in the supracondylar region is the supracondylar fracture, and we must understand that this portion will occlude the brachial artery. We know that this is humerus and the brachial artery is going through this region. So the humerus is what we said, due to this supracondylar fracture, the brachial arteries get occluded. Due to that occlusion, the VIC, what is meant by VIC? The Volkmann ischemic contracture will happen. Okay, that is the important point we want to convey from this humerus bone. So, attachment, that is origin, insertion, and its ossification and its clinical anatomy completed. Okay.